it's that time of year again, cold and flu season, and you may be hearing a lot of this. But you may be hearing more of it this year, and that's because of a type of pneumonia going around. Now, it's not like the classic type that usually hits older adults harder, especially those with underlying conditions. This one is called mycoplasma pneumonia. That's mycoplasma pneumonia, otherwise known as walking pneumonia.
What's unique about it is this is a bacterial pathogen that can pick on perfectly young and healthy people and cause this pneumonia where you're sick, but you're often not sick enough, or you don't have other medical problems that would necessitate you coming into hospital, and therefore are often treated in an ambulatory environment, which is why we call it walking pneumonia.
The hospitals in Ottawa say they are seeing more cases, along with much of Canada and the U.S. For example, Montfort reports seeing more than twice as many cases in the ER when they compare January to September this year over last. It's been the case at Dr. Alex Duong's clinic too. He's been seeing walking pneumonia mostly in people aged 10 to 19 and some younger kids. He says Ottawa Public Health told him and other doctors in November to be on the lookout for a surge. So what should you be on the lookout for?
Usually what will happen is you'll start with a fever, malaise, soreness in your body, and then you'll start to progress to a cough that lingers on and on and on. So if you're having problems with like persisting cough, shortness of breath, persisting fevers lasting longer than 5 days, then it's a good time to come and seek medical attention.
He says most of the time the symptoms are mild, but require a specific type of antibiotics to be treated, and it is transmissible.
So mycoplasma is spread by respiratory droplets. So that means if you're in close quarters, like say at a school, at daycare, at a Christmas party, then it can be easily spread. So the important thing is to make sure you're washing your hands, you're not sneezing on others or coughing on others, and to exercise some caution when you're sick.
So we know how you can get it, how it feels, and how it's treated. But the question remains, why is there so much of it around this year?
It's always occurred in cycles. So you go about anywhere from 3 to 7 years with low levels of activity and seeing cases, and then suddenly big high levels of activity. And what's happened this year is we're in a period of a high amount of activity.
Evans also says the pandemic could have affected things because we were doing so much to prevent disease, which could have changed the cycles of this pneumonia a bit. Natalia Goodman, CBC News, Ottawa.